Hello everyone, just a quick update on my project. Project involved, I posted a little video on my website at alessandroferretti.co.uk. One of the video that I posted was looking at the relationship, if there is a relationship between heart rate variability and glucose levels. At the time, I looked on only one day to actually see if it was actually worth me proceeding with that project at all. And now I have more data. I have 5 full days. I'm just going to present here only a couple. So we looked at the Friday in that specific video. And this is the Saturday still of that week. So if I move here to the Saturday, the kit I have used, as you can see here, is an Abbott Freestyle Libre. It's a 24-hour recording. It is intrusive. You have a sensor inserted in your skin and you leave it there for the time of the recording. Can last, normally the life of that sensor is 2 weeks. Whereas the equipment that I have used to measure the 24-hour ongoing recording for heart rate variability is the First Beat Bodyguard 2. So Bodyguard is the name of the actual portable ECG recorder, and First Beat is the company that actually makes it. I have no financial connections with either of these companies. I don't sell any of their products. So looking at the Saturday, I tried to line up as best as I possibly can the actual timing. So this is 12 o'clock all the way through the day, and that is 12 o'clock again. And as you can see, there is still some good consistency. So through the sleep, except for a couple of times in which there was a sympathetic activation here, we looked at a steady level, reasonably low level of glucose circulating in the blood. This is when I had a cold shower. This is my meditation. I do breathing meditation, visualization, call it what you want. Is something that helps me to set up my day, the things I want to definitely do in that case, the things I want to say. And as soon as there was a stress, is slightly out on the timing, as soon as there was a substantial sympathetic activation, that's me getting into the car, parking the car, making sure the projector is in, and etc., etc., as you can see here in the glucose is heavily reflected. Then stress activation, as you can see from the average of the blue line, that is the heart rate dropping. That's me driving nice and relaxed. Driving doesn't seem to affect me that much. Even in traffic, it doesn't seem to raise a lot. That is me trying to find a parking space in Brighton. So that is, as you can see, a reasonably good stress response. And since then, as you can see, starting through the lecture, there has a substantial increase in average, going from low mid 3s all the way to actually the 5s later on. The one underneath are other measurements that I took extra in order to maintain the consistency. So as I tried to relax later on, I thought I was reasonably relaxed, but obviously that will actually take time. And as you can see, the level started as the stress activation from, let's say, 6 o'clock onwards started to decrease. That is when the glucose had a little flicker here corresponding to that, but yet started to be lower than that specific activation. Now let's have a look at the Sunday. Even the Sunday has probably slightly more correlation. As you can see, Sunday 17th of April, Sunday 17th of April, and that is still me. I had just lost the Sunday. Here we are. So in a way, very similar. Stress response during sleep. Maybe I was recovering from the day before, but as you can see here, the first part is higher than the second part, which is the green area. That I started to toss around, slept in because it was a Sunday. And if you look at the relaxation plus the cold shower, that has brought it down further, especially in relation to my breathing and meditation. Then after that, took the dogs out and started to practice some forms, and this automatically has increased. So we can definitely say that there is a correlation, and I'm going to try to find out even more data, but I personally think that this is very exciting because we can use heart rate variability on a 24-hour ongoing measurement being way less intrusive than potentially a sensor to actually show to potential patients, clients, or researcher that any form of stress activation of inflammatory response can potentially have an effect on our circulating glucose level. Thank you for your time.